Hi there, my name's Tom Hunt. I'm the UK director of an organisation called Medic Malawi. We're a UK-based charity and we work supporting a community in central Malawi. We started in 2001 and we work in partnership with a rural mission hospital and a community home that supports around 83 children. The hospital has a staff of 116 and has grown from a one-room clinic on the edge of a maize field back in 2001 to be a large, sprawling hospital that serves a community for healthcare for around 150,000, and we run various outreach clinics across a large part of central Malawi, providing healthcare for up to 800,000 people for eye healthcare and various other outreach. I started with Medic Malawi back in September 2019, and I'm based in Exeter, down in Devon, and I oversee all the work, all the UK work of the charity, and also all the Malawi-based operations along with the team over there. We were due to go out to Malawi to visit the projects in March, but really a year's worth of planning and preparation all kind of fell apart at the beginning of March when we realised that with the COVID-19 problems we weren't going to be able to travel out. I was due to go with my wife and young kids. We were taking our 3 kids out there for their second visit, and we were going to spend a month in the community with the team, just getting a real feel for what's going on and how as a charity we can best support that community. But yeah, we had to call a halt to the whole thing with about 10 days to go before we departed. And really since then, obviously things have really changed in the UK with having to go into lockdown. So I currently, as you can see in the background, I currently run the charity from my camper van on the drive at home. And it's been a real challenge. We've had to cancel all our events over the summer, all our fundraising events, and it's really changed how we have to operate as a charity. But the change has been great in some respects. It's been really weird. We've had to change what we're doing. We launched a big project about 3 weeks ago to really respond to the COVID problems that are going to come in Malawi. The health service over there has very little infrastructure behind it. I think the statistics are that they have 25 intensive care beds for the whole country and around 17 ventilators. So we launched a project to really get out into the communities ahead of COVID arriving, to educate the rural community about how to prevent the spread of it. They've only had a couple of confirmed cases now in Malawi, but we're out early with our project to educate and spread the word to the community of 80,000 who live around the hospital. And that will make a huge difference. If we can spread that word and get the message out about social distancing and hand washing and self-isolation, we will make a difference and we will change and save lives. The other part of the project is we've really bolstered and strengthened the infrastructure at the hospital with additional equipment, oxygen concentrators, and we've supported the team at the hospital to put in place some really important measures about limiting access to the hospital, how they're going to deal with patients, how they're going to get that the infrastructure at the hospital up and together to treat those patients when they start arriving. And we've had an enormous response. We raised over £22,000 from our supporters and from our partner charities who work in the area. We managed to link up with them for the first time to deliver this project, and to raise over £22,000 in this troubling economic time is an incredible response from our supporters. So yeah, we'll keep you posted with what's going on. We're organising a phase 2 response to the COVID problems in Malawi, and we'll keep you posted with what's going on. Thank you.